Not your typical Saturday in Gaye. School is out, a clinic is in, more precisely, an outreach. The classrooms will serve as wards for patients' admission, consulting room, dispensary, and even theater. It's the closest thing to a hospital Gaye has. Without a clinic, its residents must travel through kilometers of inaccessible roads to the nearest villages.
There's a lot of challenges on the road, but as the Lord help us, we are able to locate the area.
He drove an entire team of doctors, nurses, and pharmacists to Gaye. From Kuje, it is more than an hour by road. Up hills, down slopes, through two rivers and a dried-up riverbed. The longer route takes more than 3 hours. What it has is dust and no phone signals. Political campaigns came here for votes, now they're gone and not coming back.
We spent like 2.5 hours from Kuje to come on the road terrain that is very difficult. They don't have a government clinic nearby. We've come earlier to tell the people that Soteria Afrique Rural Healthcare Initiative will come with a team of medical personnel to help the poor people. Presently, we're going to see people with different ailments and treat, and we're going to do surgery for some minor and intermediate cases like hernias and hydrocele and lipomas.
It's the first time many here have ever been to a doctor's, and there's many of them. Children aged only months and then years on filed to see a doctor. Interpreters translate questions into Tiv, Fulani, and Bagi. Clutching their prescription, they queue up for drugs in the next classroom, now dispensary. Drugs sourced and supplied to this outreach alone are estimated at millions of naira. Under the watch of elders, this room is reserved to counsel patients.
That this joint, from here downwards, it is paining her, as if something is dragging her.
Kauna Tanko is not having it. Her severe pains have gone untreated for years because she never went to hospital, and her daughter's malaria has become complicated. In the next room, the team scrubs in for the first surgery. Everything is makeshift. The school books have been pushed aside to make room for operating tables and a large flashlight. And 2 community health extension workers just back from studies in Zamfara will oversee how patients recover after their surgery or an admission once the doctors leave. Why did this outreach team, have to come here to set up this surgery in a classroom?
Just to assist people here. It's because there is no hospital here, now it's surgery.
In minutes, work starts. To remove a massive lump from the thigh of the first patient, others hang outside waiting their turns. You are scheduled for a surgery in a few minutes from now?
Yes.
A surgery for what?
For hernia.
When did you discover you had it?
I discovered it last year. I prefer to do the surgery because of the financial handcuff. When I heard that there is a free medical treatment here, then I decided to join so that in case of the financial problem, I will get an assistance over it.
This community does not have a primary health care center. The schools are in terrible conditions, and then the roads are bad. No access road is a very, very hard to reach community. In fact, it is terrible.
For communities as remote as Gaye, outreaches come by chance, but the possibilities are endless.
Incidentally, the village was already constructing. There is a house there for clinic. It's not the local government, the village. So I could adopt that and put my small structures there so that the community health extension worker or the nurse can be useful to them to treat minor ailments, give immunizations, prevent diarrhea diseases, suture their wounds, and give them medical advice from time to time.
The center will be Gaye's first and only.